Hi, welcome to the brand new episode of You Diary. Motherhood is a great honor and pride. Children we bring into this world are actually miniatures of ourselves. Every woman dreams of becoming a mother and many accomplish this naturally while some need assistance. Consulting a doctor at the right time for this is very important. To discuss further on this, we have with us Dr. Swathy Singh, Infertility Specialist, Craft Hospital, Kodungallur. Hello doctor, welcome to the show.
Thanks for inviting me.
Doctor, first and foremost, I would like to ask you, how common is this infertility?
Actually, it's fairly common these days. Nowadays, 1 in 8 couple, they suffer from infertility.
Okay.
And like we say, many patients, even young couples, even ladies who are like in their 30, 35, we see them coming with infertility problem.
What could be the common causes for this?
See, one of the main causes for infertility is delaying childbirth. As we all know, the best chance for a lady to conceive in her 20s. But because of education, career commitments, most of the ladies are delaying pregnancy nowadays. Then lifestyle factors, like we are having more sedentary lifestyle, less exercises, then having less fresh fruits and vegetables, taking food which is directly taken out from a box which contains preservative and many times harmful chemicals which we don't even know what they have put in. So because of all these factors, air pollution, loss of pesticide in our food chain, all this contribute to bad health and finally leads to infertility.
So you mean to say that this pollutions and environmental toxins have taken a toll on our health?
That is the fact.
Okay. We have a lot of queries from our audience. This is the first query.
Hello doctor, my name is Nilina Philip. I'm working in USD Global. My question for you is, my sister had miscarriage 6 months back. It was her first pregnancy and we are concerned about her health issues. So is there any test that she need to undergo?
Okay, so your sister had a miscarriage 6 months back only. At this point, I would suggest them to go for a detailed testing because this was the first miscarriage. Only thing I would suggest to go for a scan, ultrasound scan, to check for any fibroid, adenomyosis or polyp problem in the uterus. And then if that is normal, to go for a sugar testing, thyroid, prolactin. These are not advanced testing. This we do for all ladies who are pregnant. And if these things are normal, they can just try for a natural pregnancy after 3 months and she should be on folic acid supplements.
Okay, in that case, when do you suggest this advanced testing?
See, advanced testing, we like some tests which are more expensive and which are meant to look for some specific problem. Like doing a hysteroscopy in a lady with repeated miscarriage. The aim of the hysteroscopy is to look for any polyp inside the uterus or some adhesion bands. Then going for some blood testing to look for presence of antibodies. Antibodies are basically something in the blood which can reject the embryo from the body every time a lady conceives. Thirdly, to go for chromosome testing for both of the couples. Chromosomes are basically genetic material which each of our body cell is carrying. So we go for the chromosome testing. But this is recommended only if a couple has 2 to 3 miscarriages or more than that, not with 1 miscarriage.
Okay, so that is very clear. This is the next query.
Hello doctor, my name is Shyam Kishan. I want to know, how do the doctors find out the reasons for infertility?
Before getting into the detailed answer of it, I would like to explain how a normal fertility is maintained. So I'll be like, first a lady has 2 ovaries, as we all know. Ovaries are having small tiny follicles which are like small balloon like structures which contain egg inside them. We can see these follicles on the ultrasound. This is called, when we see the number of follicle, we have an indirect idea how many eggs that lady might be having, because each follicle is having 1 egg inside it. That is ovarian reserve thing. Then we check for ovulation. Ovulation is a process like from the onset of period, one of these follicle, it starts growing in size. Okay, and because of that, in the middle of the cycle, somewhere around day 15 to 18, it gains a size of 18 to 24 millimeter. That time it bursts. It comes to the surface of ovary and it bursts. So because of that, the egg which is inside the wall of the follicle, which was free floating, comes outside. So that is called ovulation. That's a very important event in fertility. After ovulation, that egg goes inside the fallopian tube. And from fallopian tube, if that time, it can go inside the uterus. If that time a couple is having a regular intercourse, regular means once in 2-3 days, then we assume that good amount of sperms will be present in cervical canal. Cervical canal is basically mouth of the uterus, and from here the sperms which are having good movement, good quality, can actually swim up. They go inside the uterus, they go up to the fallopian tube, and where one of these healthy sperms can actually meet the egg and cause fertilization. That's the start of a pregnancy. Then an embryo forms, and that embryo, after a few days, it travels back into the uterus. Now uterus is lined by a thin layer which is called endometrium. Endometrium is the place where the embryo attaches for the first time. So this is how a pregnancy is achieved. Now coming to the causes of infertility, when I have to evaluate a couple, what can be the reason for infertility? First, in basic headings, I would check for ovarian reserve, like how many follicles the lady is having. We can check it on ultrasound. Then we go for some blood testing like serum FSH, anti-Mullerian hormone. Then the second thing is to check for ovulation. For ovulation, we do blood testing which is called progesterone. This is a hormone which is secreted in body after ovulation. So somewhere in 3rd week of the month period, by day 21-22, we can check a serum progesterone, and that level can indicate if lady has ovulated in that cycle or not. Other things are follicular monitoring. Here in period first half, from 2nd onwards, we do a scanning every 6-7 days. See whether that one of the follicle is growing in size and ovulating. So if that is correct, that means ovulation is alright. There are some hormone imbalance which can affect ovulation, like thyroid disorder, prolactin disorder, some hormone imbalance like high LH level, high testosterone level, high DHEAS level. These things we can check. So the third thing is to check for whether tubes are open or not. This we do by tubal patency test. Here what we do, like through the vaginal opening of uterus, we push small amount of a fluid into the uterus, and the fluid goes into the uterus and then it spills into fallopian tube, and then it spills outside towards the ovary. So if that flow is correct, that means tubes are patent. This we can do with an ultrasound with the help of X-ray or during a laparoscopy. During ultrasound, we can check for abnormalities in uterus also, like presence of fibroid, adenomyosis or some polyps. Then evaluation of a husband, we go for basic semen testing to check for concentration of sperm, their movement. Okay. So this constitutes a basic aspect of evaluation. Okay. If a couple comes to me for the first time, it's not that I'll order all tests. Basic thing is we check for semen, we check for a basic ultrasound and thyroid prolactin. After that, what we are going to do, that depends what we are suspecting. Some ladies will be having ovulation disorder, some will be having reserve problem, some will be having male factor. Accordingly, we decide what to test.
Okay. Okay, doctor. We'll go to the next query.
Hello doctor, my sister got married 2 years back. She has done a treatment called IUI for 2 times. She couldn't conceive. What are the other options for her?
IUI is basically intrauterine insemination. It's a process where we collect semen sample, we prepare it inside the lab, we separate actively moving sperm from it, and that sperm we put directly inside the uterus with help of a plastic cannula. This usually is done for the couples who have low count of sperm, less movement of sperm, or couples who are not able to have regular intercourse. For them we offer IUI. Couples with unexplained infertility, we do IUI. As in this question, she has already done 2 IUI and she is a young patient. I will suggest her to go for 2 more IUI. If after 2 IUI they don't conceive, then they should go for further evaluation and maybe higher advanced treatments.
Doctor, for this IUI, what is the success rate of this IUI treatment?
It varies a lot actually. It can be as low as 7 to 8% to as good as 20 to 25%. That totally depends. If the lady is young, duration of infertility is short, we expect higher pregnancy rate. Similarly, when we use tablets for ovulation, pregnancy rate will be little lower. When we use hormone injection, those are costly, but then pregnancy rates are also better because more eggs are growing in the ovary.
Doctor, what are the do's and don'ts that a patient should follow post IUI?
There are no do's and don'ts. They should live a normal life and relax.
Okay, so there is no doubt of any bed rest.
No.
Okay. My elder cousin is 26 year old. She got married last year. She doesn't get her periods every month. She had not conceived yet. Her gynecologist told her that it is because of PCOD. Is there any good permanent treatment for this?
See, PCOD is polycystic ovarian disorder. This is a problem with many phases. The basic problem here is it's not that ovaries are having many cysts, they are having many small follicles, what I was talking about. So they are more than normal. Normal lady will be having 3, 10, 11 follicles, but the PCOD ladies will be having sometimes 18, 20, 30 follicles per ovary. This is abnormal. This is mainly because of hormone imbalance inside the body. There is excess of male hormones over female hormones. So because of this hormone imbalance, they don't ovulate every month. There is excess of hormone which leads to oily skin, pimples over body, facial hair all over the body. Then irregular cycles. Polycystic ladies, when they conceive, they are at higher risk for having a miscarriage. Problem of diabetes during pregnancy, preterm delivery during pregnancy. After delivery also, when they are in the middle age, they have more tendency to have a sugar problem. So basically it's a lifelong disorder. It cannot be corrected permanently. We have to follow a healthy lifestyle and plus medicine as and when needed for the problems. Like if you want to correct your periods, take medicine for that. If you're planning for pregnancy, then ovulation induction will be tried. If you're worried about facial hair and acne, for that medicine is different. But no medicine can cure it permanently. And one most important point for a polycystic woman, whether she's a teenager or in her 40s, to maintain a good normal weight. They should not put on weight, because the more weight they'll put on, the more strong hormone imbalance they'll have, and that will aggravate their problems.
Okay, doctor. Now we will go to the next mail. My elder cousin got married 2 years back. They are still waiting for their pregnancy to happen. The doctor told them that this is because of problem in semen. What can be the reason?
See, the problem in semen, it can be classified into many groups. To start, there can be problem of semen production. Like there is less production, which is called oligospermia in scientific term, or no production at all, which is called azoospermia. Then there are few males who have normal production. As we all know, sperms are produced in testes, and from testes they come out, they come in the semen sample. So if there is a blockage in the channel, they can have, even if the sperms are there, it won't be there in semen, which is called obstructive azoospermia. Then there is a third group of seminal problems where sperms are there in the semen, but they are not showing good movement. As we all know, after natural intercourse, sperm should swim up towards the egg. So if the motility is less, it can affect pregnancy chances. The final thing is sperm morphology. Sperm is a very small structure, but even when it reaches near ovum, if it is healthy, normal shape and structure, then only it can fertilize an ovum. So all these factors should be normal, then only normal pregnancy can be achieved. I think your brother, he should go for a basic semen testing again, and depending upon what was the count, motility, other issues, we advise for further testing to check for the cause and treat accordingly.
Doctor, is there any treatment if there are no sperms?
Yeah, definitely they can go for, if there are no sperm in semen, they can go for sperm retrieval directly from the testes, which is called testicular sperm extraction.
If sperm is not retrieved by TISA, then is there any option?
Yeah, we can try some hormonal injections for the male, and after that we can try a microsurgical sperm extraction, which is called micro-TISI.
What is this endometriosis?
Endometriosis is basically abnormal presence of endometrium, which is the lining of the uterus outside uterus over the tube's ovary. And because it bleeds during every period, it results in scarring of the tissue, and all body organs, they get stuck to each other. So that way it can interfere with normal pregnancy chances. When we do laparoscopy, we can see these bands, adhesion bands, and we can break them and put the body organs to their normal position.
Okay. If not conceived by laparoscopy, what can be the next treatment?
If they are not conceived 1 year after laparoscopy, then depending upon their age, they should go for IVF fixing.
Okay. What is this IVF fixie?
IVF fixie is basically advanced form of infertility treatment. Here we give injection to the lady for egg growth, and when many eggs are growing, once they are mature, we take them out from the body. And inside the lab, then we mix them with sperm. That is called IVF. And sometimes each egg we put one sperm inside. This is ICSI. ICSI is basically advanced form of IVF. And after that we get an embryo. This embryo for few days it is cultured in lab. That's why it is called a test tube baby. And once we have good embryos ready, we put them back inside the uterus.
Okay. How successful is this infertility treatment?
I would say if you do it in a stepwise manner, these treatments are usually very successful. If I have 100 couples to start the treatment, 90 of them will conceive. Some will conceive with ovulation tablet, some with IUI, some might have to go for laparoscopy or IVF fixie depending upon the problem. And it's not that if we do IVF fixie in one time all will conceive. Usually for per cycle we expect a success rate of 20 to 50% depending upon what is the factor causing infertility for that particular couple.
This is for IUI?
IVF.
IVF, okay.
Okay, and then like sometimes couple don't conceive in first cycle of IVF, they go for second cycle, and usually by third cycle almost 80-90% couple they conceive. So I would say treatments are fairly successful and couple should not give up hope.
Do you have any tips to suggest for our young viewers?
Yeah, definitely, because that's the best time to start. For girls, they should be having an active lifestyle. Usually what happens for girls, once they are like in their teenage and they high school starts, they stop going out and playing. That should not be done. They should be physically active, playing, then eat lots of fruits and vegetables, avoid all junk food. And then if you have any problem like irregular period, very painful period, and heavy bleeding during periods, lots of hair growth over face, then whenever you are like married and planning for a pregnancy, you should consult a doctor early.
I hope this was a valuable session for all those who are married and planning for a family. All your further queries will be answered to youdairy@rosebowl@gmail.com.